Welcome to the PEMF Today podcast. Today's episode will be a replay of my presentation at the World Congress of Cosmetic Gynecology and Body Contouring in March of 2024. I was done, depressed, broke, and probably had a few drinks. Walt Whitman says to be curious, not judgmental. By the way, would you like to know the rest of the story about my depression and being done? Okay, all right, we'll do that. Walt Whitman said be curious, not judgmental. That's what I want to do this morning, is help you be a little curious to understand what we do, what we have done, why we have done it, and where it can go. Being curious leads to knowledge and understanding. So here's part of the rest of the story. I have a background in microbiology and pathology that I've never used until I started my company and after I was depressed and broke. I was in the aviation business before 9/11s. Jet aircraft sales and maintenance. 9/11s basically broke us within 2.5 months. We lost $2.5 million, everything we had. Because of 9/11s, had to do something different. My mother had some horses when I was a child, and I worked around horses at Ellis Park Racetrack while in college as a TV producer. A friend from Canada says, "Hey, I need some help with my equipment at Churchill Downs, and you know a little bit about horses. Would you like to help me?" I said, "Sure." So he said, "Don't go to Churchill Downs immediately because they will eat you alive. You need to work into it, do other horse shows, and this stuff." So I went straight to Churchill Downs, walked around for 2 weeks, met a couple of trainers, explained my situation, and they said, "Visit us every day. We'll tell you who to talk to, who not to talk to, where to go, when to be here, and when not." I did that, and we began building a PEMF business. From 22 into 27, I dealt in low-powered devices, which I'll explain. In 2027, we found what are now called high-powered devices. My wife, who is a teacher, fell on the ice, had 3 herniated discs, could not raise her arm above her shoulder, and was in pain continually. We did acupuncture, massage, and everything else short of surgery. She had no relief. We were in Nashville, Tennessee at a horse show. Someone said, "You must try this machine we found in California to see what it'll do." I contacted the company, and they were going to an anti-aging conference in Orlando, so we headed that way. At a product demonstration, they asked for a volunteer with some issues. My wife raised her hand and said to me, "They're not going to help my back and shoulder." She sat down with this machine for 8 minutes, stood up with total mobility and no pain. It only lasted 24 hours, but it worked. The bad thing for me was she bought a machine for $20,000. So all of a sudden, I was in the high-power PEMF business. So that's what happened when we moved to high power. After 60 days of regular sessions, she was pain-free for 3 to 4 weeks with great mobility. For the last 15 years, 3 sessions every 3 to 4 weeks keeps her in good shape. Primarily for the first 10 or 15 years, we were a veterinary company, racehorses, performance horses, show horses, anything around the world or the country dealing with horses. However, I got my horses by treating people. The rider would have a sore back, we'd treat the aching back, the rider would feel better, get on their horse, and after feeling better, they'd let me treat their horse. Everything was great because the horses responded immediately. In 2016, we began to manufacture our own devices, and international sales forced us to decide on our commitment to safety testing and the FDA. We had to go to the FDA to be able to export our devices. Around the world, our therapy is mainline medicine. In the United States, it is not. In 2019, we made the commitment to pursue safety testing and following the FDA for manufacturing and product clearances. On a side note, we typically treat 15 out of 20 horses in the Kentucky Derby, and the first 3 horses in this year's Kentucky Derby were horses we were treating. Here is a brief history. Nikola Tesla harnessed the power and potential of electromagnetic fields. Tesla's experiments pushed the boundaries of what is known, paving the way for developing PEMF devices. PEMF, pulsed electromagnetic field therapy, is a therapeutic modality that produces electromagnetic fields that will penetrate through your body. Your bone, your tissue, your nerve, your cartilage, everything is penetrated by this signal. It enhances the cellular membrane, allowing permeability and increased oxygenation, which provides inflammation reduction and pain relief, which allows for the body to better heal itself. As we know, all pain is a result of inflammation. Here's where it gets interesting. The Flexner Report of 1910 was funded by John D. Rockefeller and supported by the American Medical Association about the quality of medical education in the United States. PEMF was removed from mainline medicine in the United States along with acupuncture, massage, naturopathy, chiropractic, and osteopathy. That's why many of these modalities and professions have struggled over the years to gain a position in the United States. I didn't know we had a canceling type of situation back in 1910 like we have today with some issues. I don't want to say it was canceled, it was suspended. Again, PEMF is mainstream medicine worldwide, just not in the United States. Space travel facilitated the rebirth and growth of PEMF in the United States and the world. When the astronauts would go to space, they'd come home with atrophy of the muscles, bone density issues, and all of that. Yuri Gagarin, the first Russian astronaut, died as a result of space sickness. William Schumann discovered what became known as the Schumann frequency, a PEMF frequency, which, when applied to the astronauts, reversed the space sickness as it was called, and it has been used extensively in space travel ever since. And that allowed us to begin to move forward again, to move up. There are two types of PEMF. There's low power PEMF, a frequency that penetrates the body and does excellent stuff, but it's slower. Then there's high power PEMF, which is what we do, that penetrates deeper and is much faster. The results can be instantaneous. If someone's got a sore back, they can sit down for 10 minutes, get up and feel better, feel some relief. Not reversed necessarily immediately, but relief. The more you treat it, the longer the results. So are there FDA-cleared devices? At this point, 10 or so PEMF devices were cleared in the United States. In 1979, PEMF was approved for non-union bone fractures. In 2004, it was cleared for cervical fusion patients with a high risk of non-fusion. It helps the bones to fuse. In 2006, treatment was cleared for depression and anxiety. You may know that as a TMS or transmagnetic stimulation. 2011, it was cleared for treatment of glioblastoma brain cancer. It does not kill the cancer or the tumors, but it reduces the size of the tumor and relieves pain, which provides a better quality of life and often allows for improved surgical procedures. This particular device has changed that entire situation when discussing cancer and PEMF. In 2019, a device you may know of, the Emsella Medical Chair for Urinary Incontinence, was FDA cleared. And in 2023, the Nova HD Plus, our device, was cleared for inflammation reduction and pain relief. We have one device cleared and one in the FDA for clearance to be used in the human space. We now manufacture all our own devices in Louisville, Kentucky. We have all the certifications for international use. Much is involved when you start dealing with the FDA and move your devices toward clearance. Here's where we are. 5 years, $5 million. So, what is the role of PEMF? PEMF therapy can improve the blood flow, oxygenation, and circulation. Basically clear up the area you're going to be working on. And we've found that it can potentially reduce bleeding during surgery. Post-treatment, while improving the blood flow, oxygenation, and circulation, PEMF will also help reduce scarring, reduce inflammation, provide pain relief, and speed the healing process. We've noticed this in the equine space and the veterinary space. You break a leg, you put on a cast, we're going to be careful for 8 weeks or whatever the situation is. A horse doesn't understand that. Horses break a leg, it is put in a cast. That horse is going to try to get up and continue to go. And so what happens if they go for an x-ray? Sometimes the bone shows that it's healing from the outside, but it's not necessarily showing on the inside with radiology. We try to speed up the healing of a bone by 25 to 50% in those situations. In the veterinary space, that's very important because the animals don't listen to you when you want to tell them to slow down and not over-exercise that particular issue. Today, we have rent-to-rent systems for our practitioners where a patient can have surgery, have some work done. You rent a machine to the client. They take it home, treat themselves for 30 or 60 days, whatever the time is to help them heal more rapidly, get over the situation, less scarring, and so forth. But what happens in these situations from an additional stream of income perspective is that someone takes this device home to treat their surgery, and the spouse has a sore back, or the dog's got arthritis, your mother's got something going on, and after 30 or 60 days, the machine doesn't come back. The people want to keep it and buy it. So it turns into a potential additional stream of income. So, where are we in research? When we decided to deal with the FDA, we had to validate and substantiate everything we were doing with research. So, all of my brothers had prostate cancer, prostate surgery, prostate removal. My time came when I was 62 years old. My doctor said, "It's your turn." He didn't like what he felt. He didn't like what he saw with the ultrasound. He didn't like what he saw with the MRI. And he said, "I'm going to do a biopsy in 8 weeks." I went home. I got on my weakest machine and began treating myself twice daily for 20 minutes. 8 weeks later, we did the biopsy. It was dead. I've been clean for 14 years. I go back every 6 months to Dr. Bard in New York City, who does an ultrasound examination, and the only thing that I did was PEMF because it increases the oxygenation in the body. The oxygen attacks potential cancerous issues, and that was my result. I make no claims, but from an anecdotal perspective, that was my particular result. We started using Dr. Bard for verification because there's not much validation in the United States, as I was talking about for PEMF. We used ultrasound to validate what we were doing. The FDA asked, "Show us how you're manipulating that muscle. The muscle moves when you feed energy to it." Dr. Bard used his ultrasound, which showed the muscle movement and stimulation. We submitted that to the FDA, and they said it was great, and our initial clearance followed. With Dr. Bard's clinic, we did a pilot study for prostate. In New York, if you're a volunteer fireman or first responder, you're done if your PSA level hits a certain point. They don't want to deal with the workman's compensation and the insurance issues. So we went and took 4 people who were in this type of classification. We put them on our least potent machine for 30 minutes a day for 30 days. I had 8 weeks when I was attempting to treat my prostate. We did the pilot study for only 30 days with our weakest machine. All 4 clients had a 25 to 40% reduction in PSA and inflammation after just 4 weeks. Now we will move on to do a more full-blown study in that area. We are currently in the process of a pilot study on endometriosis, which we've had success with anecdotally, but we want to do a pilot study to bring it to fruition with Dr. Bard in New York. Mayo Clinic contacted us because a horsewoman who is a doctor used our device to treat her horses. She works at Mayo Clinic with clients who have mastectomies, and she began to take a device to her office because what happens when women have radical mastectomies, they are put on aromatase inhibitors to stop the production of estrogen in the body, and 30 to 40% of the women go off of the medication because of the pain that's produced as a result of the medication, rheumatoid arthritis types of situations. We found that if we treat these women with our type of device, they tend to stay on their medication. Mayo Clinic came to us to talk about that, and we are in the process of an IRB to do a full-blown study with Mayo Clinic on the aromatase inhibitors and radical mastectomies. We presented this last year in Vienna at the International Skin Disease Symposium because Mount Sinai Hospital found that if you put a topical on the body and treat it with the PEMF, you'll get a better absorption and a quicker return for what you're looking for by using PEMF to stimulate the topical ointments. So we presented there, and we've been invited back to present again with Mount Sinai in 2025. So if you're curious about Dr. Bard and what he's done, visit www.bardcancercenter.com or patziemer.com and click the research button. I recently presented at a stem cell conference about the effects on stem cells and exosomes. Applying PEMF appears to enhance the body's metabolization of the stem cells. We're also working with Main University in Vienna, Austria, on specific cell development, mitochondrial action, and utilization at the cellular level using PEMF to stimulate the cells. Here's an interesting one. In 2022, Vosburg Valley View Farm was losing its dairy cattle to toxic mastitis and acidosis. We did a study with MagnaWave. With a series of MagnaWave sessions, the death loss was only 11% of the cattle. Without MagnaWave, 50%. MagnaWave is our veterinary device, so that's what we used for this study. 67% of the cattle recovered with MagnaWave, 0% without the MagnaWave treatments. From that perspective, it's a fascinating study. Professional teams that use the PEMF modality include in the NFL, the Arizona Cardinals, Seattle Seahawks, Denver Broncos, Atlanta Falcons, Dallas Cowboys, Green Bay Packers, Baltimore Ravens, Buffalo Bills, New York Jets, San Francisco 49ers, with more joining us all the time. In the NBA, the Phoenix Suns, Los Angeles Lakers, and the Minnesota Timberwolves. In the MLB, Texas Rangers, Chicago Cubs, Los Angeles Dodgers, Chicago White Sox, and the Florida Marlins. In professional soccer, the Vancouver Whitecaps, Louisville City, Racing Louisville, and Manchester United. The use of our type of PEMF modality is increasing in professional sports, where the modality is used pre-event and post-event for many years with no complaints or concerns about efficacy of the modality. Our entry into Major League Baseball was because Tommy John surgery on the shoulder and elbow for the pitchers. The Navy SEALs use it for what they call their buds in training. We have devices with the Navy SEALs, and now we're talking with the veterans' hospitals about using the therapy for prevention and aiding in the healing of bed sores. We have come a long way, but we have just barely scratched the surface when it comes to the potential benefits of utilizing PEMF for improved health and wellness. Thank you very much for listening. Stay tuned for much more information about PEMF. So until next time, this is Pat Ziemer. Have a great day.